large area, covers Leicestershire County, Rutland and Leicester City. We've got about 150,000 5 to 19-year-olds, 0 to 5 as well. We've got thousands and thousands of those. I'm going to talk about co-design, and it's been a strong thread through the whole day, co-design. We're very proud in Leicestershire that we go out there and we talk to our families and we find out what they want. So we've held 27 events, and they were held in playgroups, in nurseries. We went out to the families to ask what they want, and nearly 500 parents responded. We asked them what they wanted and what they thought of health visiting services. As you'd expect, we asked the normal questions about buildings, accessibility, were they private enough, did we talk about brushing teeth, all that sort of stuff. And the important thing that we're talking about today is we asked them what changes they wanted to see to the health visiting service and the team. So we had these fancy graphics. We can't take credit for that. We had an agency doing that, but this is what we came up with. So I'll go through each of them individually. Well, not each of them, we'd be here all day, won't we? But each sort of co-subject, just to pull out some key things. You will note that it's 0 to 19. I know we talked a bit earlier about 0 to 24, but we're very much not talking about health visiting and school nursing. We've gone out to tender, and it's very much 0 to 19 service. So that's been quite new thinking for us, and we're getting into this new way of working. So when we talk to the parents, they're very clear what they wanted. The very top thing that they wanted easier access to the health visiting team or the 0 to 19 team. They wanted clear expectations. We give them a nice little leaflet. We tell them all about our 5 contacts. They can contact us when they want, all that sort of stuff. But they seem to forget. They don't remember all that information. They don't want all the medical terms. We think that we're quite good at talking plain English, but it was very clear that we still talk a lot of medical terms and they don't understand what we say. They wanted a clear plan of what happens. They wanted a timeline. They wanted to know what exactly happens here, what happens at 12 months, what happens at 18 months, all that sort of stuff. They wanted to know almost month by month, didn't they, what was happening. They wanted consistent advice. I know Ruth touched on it earlier in the website, but that was a huge complaint, that they phone up one health visitor and get one sort of information, and then they phone up another health visitor and get something totally different. And they all said that they wanted consistent support. They wanted the family at the centre, and that's very much why we go out and we talk to our families. We want them right at the centre of making all our decisions and the service that we are providing for them. And they wanted to know about community. They wanted us to tell us about the community groups, what was out there for them, which is really hard, because I know in your areas as well that it changes from week to week, doesn't it? But they felt that they needed to know where all the groups were, where they could go for support that was up to date and not years out of date. So they wanted supporting through that journey from 0 to 19. They wanted to know little things like, is this normal? All those questions that they think that they can't ask somebody, they wanted to ask us, because they know that when they Google it or ask their family and friends, they get lots of different answers. They said that they wanted us to respond promptly. Lots of them said that they leave a message and we get back to them the next day, and we miss them and then they get back to us the day after. It can take days and days just to get one little question answered. So they wanted us to be a bit more prompt. They wanted to communicate to us through texting, through phone, and they also mentioned Facebook as well. Interestingly, they didn't mention Skype or FaceTime or anything like that. They were very keen on phoning, texting, and Facebook, all those sorts of things. They wanted one point of contact. They're fed up being passed from pillar to post. They phone one number and nobody's there, and then they get told the health visitors on annual leave or left or retired. They just wanted one number. They wanted the right information at the right time. And I know Ruth said earlier, when we see them at the primary visit, we tend to give them this bundle of information, and they say that they don't need it then. They've got too much on their minds. The Red Book, which we think's got loads of useful information in, the parents there at the co-design groups have no idea. They could look at it, no idea what information was in it. They just thought it was there for us to put our weights in. They didn't realise it had all that sort of information. And we said, but we tell you. But they just say, but you tell us so much at that visit. It just goes like that. Leaflet overload. Again, I know we all feel the same, don't we? And it's something we're hoping to link in with the website. They talked about central booking, which we haven't really got there yet. I don't know if anybody else does central booking, but they talked about having that system available, so it's something we'll certainly look at. And they wanted more contact with a health visitor. And they didn't necessarily mean face-to-face. They just wanted to text somebody, phone somebody, and get that prompt, consistent, professional support, which is what we all aim to do anyway, isn't it? So where do we go from here? So as you've heard this morning, they've had chat health and school nursing. So obviously the next step for us obviously would be to offer the 0 to 19 chat health. And Emily will go into that in a bit more detail. So I'll hand over to you. Thank you.
I'm just going to have a chat to you today about how we're rolling chat health into health visits. I think we've talked a lot today about smartphones. We all use them. Probably everybody's got one here, and if not, they kind of know how to text, how to send an email. So this is just a few statistics about how many people actually own a smartphone now. 35 to 54-year-olds, so still quite a high number of percentage of people still have a smartphone. Now the next slide, we're not going through my whole wedding album, but this is me a few years ago, few stone lighter with my husband, my grandma and my granddad. My grandma is 77, my granddad was 83 at the time of this. My grandma texts me every week. She can send me photos, she can use the internet, she mainly asks about how my child is, just really cares so much about me these days. But, you know, these people can use smartphones now, so this is just showing us that actually we need to move on. Everybody can do it, and if they can't do it, everybody knows that somebody else can do it. So that's why we're moving on with the times now. So chat health, Caroline showed you a bit of a demonstration earlier. Obviously we've been using the system on here. This is the home screen there. So it's a secure network. We respond to messages as they come in. Health visitors can set up alerts, so you can either have a text message or an email come through to say that there's a message in chat health. So you haven't got to sit on your computer all day watching for messages to come in. When we started this process, the team leaders, I think, were a bit concerned about the amount of time that health visitors were going to be spent doing this. So they were worried really that they weren't going to be able to carry out their health visitor duties. But what we're saying and what the school nurses are saying that are already using this system is that they can work alongside that. So they can still do their visits during the day, but they know they've got to make time to check the messaging service. So it's about getting that balance and not spending all day doing it. So how does it work? We've gone into it already today, but secure network, school nursing works really well. So that's why we're now rolling it out into the health visiting service. Like Sharon said, all the parents have said that they want an easier way to contact their health visitor. So we're just following on from the good work that the school nurses have already done. The health professionals will cover it on a rotational basis. So we set up a rota. Obviously we're Monday to Friday, so we will have a health visitor and a school nurse that covers the service daily. So they will cover Leicester City and Leicester County. Now when we started setting this up and talking about it, that's obviously a lot of young people, a lot of children. So I think when we were telling people about it, they thought, oh my God, you know, we're going to be answering a lot of messages. The school nursing's been going for some time. The health visitor we haven't started yet. So it is going to be one of those that we've got to roll it out. We've got to see how it goes. Since we kind of took a step back and looked at it, we've realised that actually, as we market this, this is predominantly going to be marketed to parents that are just having a baby now. So when we go in as health visitors to see them in their homes, we're going to be giving them information about this new service. So actually the parents like myself that have got a 2-year-old, that have got older children, unless I was in this job, I wouldn't necessarily know about this unless I'd seen it advertised somewhere. So actually we think that the target kind of audience is going to be quite small initially, like everything, until it grows. Word of mouth, they see posters, and they see our promotional material. So recruiting ambassadors, we talk about ambassadors and they're the kind of triage nurses that people have spoke about today. So we ask for health visitors to come forward to help us with this service. We've got around 15, so we have chose pilot sites, which I'll go into after. But all of those 15 health visitors approached us and said they wanted to do it. So we haven't had to do the whole, come on, let's see you around everyone, please, someone come and help us with this. They've listened to the work that the school nurses have done, and they've obviously, thought that it's worked well. They've seen the statistics behind it. So all of those people are really positive. We've had meetings with them, and they, are really engaging with us well. So we're looking forward to working with them because it makes it so much easier when people have volunteered themselves instead of us begging for help with them. Our pilot size, so we were piloting this across 5 areas of the city and county. We've actually got more than 5 now because we had people come to us and say, actually, we want to get involved as well. So we're having them on board as well. We're starting the roll-out process with parents of 0 to 5-year-olds. So after we've done that initial pilot period, we'll be expanding it to parents of 5+. And that's just to see how we get on with that small amount of people before we open it to everybody. We have got staff that are currently having training. All of the ambassadors now, apart from 1 or 2, have had the training. So in the next few weeks, next month, we will be rolling it out and it will go live. They've already showed you the guidance earlier, so we're working towards the same guidance that we've adapted to make sure it's appropriate for health visitors as well. As we said, the staff work on a rotational basis, so the same staff aren't doing it every day. It works out that each staff member will be doing it once every 2, 3, 4 weeks. Obviously, the more ambassadors we have on board, the less amount of time staff are going to be doing it. So that's kind of how the managers really have been sold about it. They know that they're not going to have a member of staff doing this every day. Staff will be working on a buddy system, so we're trying to buddy up health visitors with school nurses that have already been using the system, and that's just to give them someone that they know they can contact if they're having any difficulties, someone they know really that's used the service. So that's what we're trying to do to kind of support the staff. We have got some specialist sites that are also getting involved with it. We've got Tracy and Kay here, and they are from Early Start. We thought Mary was coming from the Travelling Planet, but I've not seen her, so unless she's crept in, I don't think she's here. So if anybody's got any questions that they particularly want to know about that, hopefully Tracy and Kay will have to answer those. The 3 specialist sites are separate to the 5 pilot sites, so they'll be having exactly the same service, but they will just be managing it themselves. So as specialist services, their staff will be answering their own text messages from their own clients. So each of these 3 sites will have their own phone number. So instead of texting into the main health visiting number, they will text into their own number, which is where the staff will manage between themselves.